This year, United Physicians has taken a much more proactive stance on quality. In the past, we've sort of communicated what the HEDIS measures are, that the plans are tracking for the quality performance measurements. But what we've done this year is really tried to, not only communicate that information, but also provide what a practice needs to implement a really solid process around closing gaps in care. So it started with the HEDIS Health Fair. We had a variety of different stations from start to finish on implementing a program for breast cancer screening. We had those sorts of materials available to practices. We've also focused on quality within the POM ACO. That's our Medicare Shared Savings Program, and we need to pass a quality threshold on the ACO measures to be eligible for shared savings. So we created a series of educational modules that the POM ACO physicians and key members of their office staff have been asked to complete so that they're familiar with what those measures are. This is kind of crunch time for closing gaps in care, and we've hired a team of panel managers so that we can help the practices with data entry, with outreach calls, anything that we can do to help them be successful, because there are incentive dollars linked to these quality measures. You do a lot of work and it takes a while before you see the results. So we're able to track our performance this year in comparison with the same point in time last year. One of the things that we feel is really important is, it's not just checking the boxes, but it's establishing that process, taking the time to say, okay, our biggest opportunity is around colon cancer screening. How do we systematically identify those patients, come up with a solid outreach program, close the loop and follow up with them to see if they've completed the screening. So that's a lot of the work that our practice transformation team is doing, and also the resources that we've put together as part of that HEDIS Health Fair. Because our network is so large, there's just a huge number of opportunities, and some of these things are difficult to complete. Retinal eye exams, you can tell your patient with diabetes that they need to have their eye examined. Well, if they go to an ophthalmologist, a claim's generated and that information gets back to the health plan. But if they use their vision benefit and they go to an eye center or an optometrist, a claim's not generated, and there's a lot of tracking of that. It's very, very challenging for the practices, and that's where we're really looking to, what are the things that UP centrally can do to help.